Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. This week, I had the chance to work with one of our local family medicine residency programs, and they requested, Rory, can we talk through depression and anxiety? We're seeing it a lot in our clinic, and we want to make sure that we're talking through both the PHQ-9 and the GAD-7 screening instruments correctly. So Pfizer has put out Spanish versions of both the PHQ-9 and the GAD-7, and so that's what we used as our base. Make sure you download the notes here. If you're not seeing this video on our blog post, make sure you head over to the blog post where you can download the notes, the slide deck for our presentation today, and these instruments in Spanish. So that's how we've organized our session today. We're using the GAD-7 and the PHQ-9 to talk through síntomas de la depresión y la ansiedad. So let's start out with la pregunta clave. La pregunta clave is durante las últimas 2 semanas. So during the last 2 weeks, durante las últimas 2 semanas, ¿con qué frecuencia has sentido? So how often have you felt o ha tenido, have you had, molestias por los siguientes problemas? Have you had troubles, bothers, molestias, problems por los siguientes problemas? From the following problems. Another way to ask that same question is to switch up the con qué frecuencia is to ask ¿qué tan seguido? It's just another way of saying how often. ¿Qué tan seguido has sentido o ha tenido molestias por los siguientes problemas? And you know the instruments, right? And it goes through and you rate each one. So let's take a look at las frecuencias importantes. The important frequencies, un cero is nunca or ningún día, never or, no days. Uno is varios días. Dos is más de la mitad de los días. So la mitad is our word for half. So more than half of the days. Y tres, casi todos los días. A tres is almost every day. Okay, so esas son las frecuencias. And we've got la pregunta básica over the last 2 weeks. Let's start with síntomas de la depresión, looking at the PHQ-9. Okay, so signos y síntomas de la depresión. I've organized them not in order of the questions, but grouped them by grammar and how you can ask the questions or talk through the symptoms. So first of all, we've got our verb tiene, our verb to have, right? Tiene. Poco interés en hacer cosas. So little interest in doing things. Poco interés en hacer cosas. Poco placer en hacer cosas. Little pleasure in doing things. No tiene apetito. You don't have an appetite. Tiene dificultad para. So you have difficulty. And what's great about, and why I've separated it out this way, dificultad para dormirse. Difficulty falling asleep. Dificultad para permanecer dormido. So, tiene dificultad para, you could in any other context put any infinitive verb next and talk about difficulty urinating, difficulty breathing, difficulty whatever it might be. And it's really simple. You just use the verb in its unconjugated form. Like we've got here, dormirse, falling asleep. Permanecer dormido, staying asleep. Dificultad para concentrarse, concentrating. All right, se siente. Se siente, you feel. This is like feeling an emotion. Se siente decaído. Decaído is our word for down in Spanish. Decaído for a man, decaída for a woman, right? Se siente decaído. Se siente deprimido, depressed or deprimida. Se siente sin esperanzas, without hope. Se siente mal con usted mismo or usted misma. So you feel bad about yourself, okay? Se siente un fracaso. This is our way of saying you feel like a failure. Se siente un fracaso. Se siente con poca, excuse me, se siente con poca energía. You feel like low on energy. Se siente culpable. You feel guilty. Culpable, interestingly, isn't on the PHQ-9, but we added it in there because it's one of those common ones, right? Otras frases. Otras frases. Duerme demasiado. You sleep too much. Come demasiado. Eat too much. So demasiado is our word for too much, okay? Queda mal con usted mismo or queda mal con su familia. The expression queda mal doesn't have a great perfect equivalent. It doesn't make a lot of sense for a lot of us native English speakers, but this is the best way to say really look bad in front of someone else. So, you know, look bad in front of your family. Another expression that often comes up when we talk about cultural norms and values, losing face. So quedar mal could be interpreted as like losing face with yourself or in front of your family, okay? Se mueve, you move, o habla or speak tan lento, so slowly, que otras personas lo notan, that other people notice. Está inquieto, you're sort of restless, unsettled. Es inquieto o agitado or agitated. Y se mueve mucho más de lo normal. And you're moving a lot more than normal. Okay? So these two getting at the psychomotor pieces of depression, right? Okay, piensa que estaría mejor muerto. You think that you would be better off dead. Piensa en lastimarse de alguna manera. So you think about harming yourself somehow. Okay? So, los signos y síntomas de la depresión. Most of these taken directly off of the PHQ 9. Okay? Bien, continuamos con los signos y síntomas de la ansiedad, now referring to the GAD 7. Okay, tiene, similar breakdown now, grouped by grammar. Tiene dificultad para relajarse, difficulty relaxing. Tiene dificultad para relajarse. Tiene miedo que algo terrible pudiera pasar. So you're afraid that something terrible could happen. This is the sort of impending doom equivalent, okay? Continuamos. Se siente nervioso o nerviosa, nervous. Se siente intranquilo. So tranquilo is like calm or chill, and so intranquilo, the opposite. So like just unsettled, like inquieto, okay? Se siente con los nervios de punta. What might this mean? You feel like your nerves are on edge. So you feel on edge, okay? Otras frases. No puede dejar de preocuparse. You can't stop worrying. Dejar de is a good verb for stopping doing something. No puede dejar de preocuparse. Can't stop worrying. No puede controlar la preocupación. Similar question or similar description. You can't control your concerns or worries. Se preocupa demasiado por diferentes cosas. You remember demasiado? That's our word for too much. Se preocupa, so you worry too much about different things. No puede permanecerse sentado. You can't stay seated. You know, stay is such a nice short word in English. I'm sorry it's so long in Spanish, but it's actually not my fault. Permanecerse is to stay. Sentado por estar inquieto. Por, in this case, because you're so unsettled or nervous, okay? Se molesta fácilmente. You get bothered easily. Se pone irritable fácilmente. Similar, so you get irritable easily. All right. Also not in the GAD 7, but relevant when you're talking anxiety with patients. I thought I'd throw in a few symptoms of ataques de pánico, okay? So síntomas de ataques de pánico. Tiene palpitaciones, palpitations. Tiene dolor en el pecho, pain in your chest. Falta de aire, lack of, shortness of breath, see? And then ansiedad and anxiety en ciertos lugares, in certain places, o en ciertas situaciones, in certain situations. All right. We're going to move on to algunas preguntas a continuación. So some follow-up questions. But just a quick pause. Hey, if you're learning something new in this lesson right now, please subscribe to our channel, like the video. This is how we build our community and how it helps us to continue, helps me to continue giving free Video Viernes lessons. So please make sure you subscribe to our YouTube channel and like the video. Comment on the video too. If you've got some additional questions, we'd love to answer your questions for you. All right. Preguntas a continuación, some follow-up questions. Usted marcó que se siente however you feel. So you marked that you feel nervous about something, let's say. ¿Podría explicarme, could you explain to me un poquito más sobre cómo esto le afecta? And could you explain to me a little bit more how this affects you in or at el trabajo, at work? La familia, in your family. En sus relaciones, in your relationships, okay? So How is this stuff affecting your work, family, and relationships? Have you been able to cumplir con sus responsabilidades? And so what's this question asking? Have you been able to follow through with, cumplir con is follow through with your responsibilities in el trabajo, again, work, la casa, at home, con su familia, with your family, etc. Okay. Otra pregunta. ¿Cuándo empezaron estos sentimientos or síntomas? When did these feelings or symptoms start? ¿Cómo hace para aliviar los sentimientos que tiene? ¿Cómo hace? How do you alleviate the feelings or the symptoms that you're having? Okay? ¿Le han diagnosticado? Have they diagnosed you con la depresión o la ansiedad antes? You know, whatever you're talking about, you choose. Le han diagnosticado con. Have you ever been diagnosed with this? ¿Alguna vez have you ever pensado en lastimarse? Have you ever thought about harming yourself? Lastimar a otra persona, harming someone else. And then otro verbo, suicidarse, committing suicide. Okay? Okay. After we've had some conversación adicional, we've got some recomendaciones y próximos pasos. Now, for you beginners out there, this is going to be vocabulary learning for you because there's some pretty high-level grammar involved in giving someone a recommendation the way we've got it set up here, okay? So if you're intermediate, advanced, we're going to see the subjunctive form here now. Okay, it's important que usted hable con, that you speak with somebody, okay? Que haga ejercicio, that you do exercise, que coma una dieta balanceada, eat a balanced diet. Tome sus medicamentos sin falta, so you take your meds without missing. All right, so a few, es importante que usted. All right, if you'll notice, if you've studied the command form, the usted command forms of verbs, you'll notice all of these are essentially the usted command form of the verbs, okay? Recomiendo que usted, we're still going with this change in our verbs here. Recomiendo que usted consulte con un psicólogo, consult with a psychologist. Programe una cita de seguimiento conmigo en 2 semanas. That you schedule a follow-up appointment, cita de seguimiento conmigo en 2 semanas, with me in 2 weeks. Llame si tiene problemas con la medicina. Call if you have problems with your meds. Que vaya, that you go a la sala de emergencias si piensa en lastimarse. That you go to the ER if you think about harming yourself. Que llame a la línea de crisis. You call the crisis line. All right. Voy a recetarle un medicamento para, I'm going to prescribe a medication to you for, voy a recetarle un medicamento para su ansiedad, your anxiety, su depresión, your depression, para ayudarle a dormir, to help you sleep. Okay? Bien. And then finalmente, quiero referirle al, I want to refer you to, quiero referirle al consejero o terapeuta, counselor or therapist, psicólogo, psychologist, psiquiatra, psychiatrist. Okay, we were talking with the family medicine program about their patients saying, you know, not really connecting with the words consejero or terapeuta, but really connecting with the word psicólogo. And I think this happens a lot in a lot of settings, and not just the mental health kind of context where, you know, we in the U.S. have a bunch of different professions for the same thing with different levels of education and stuff. And oftentimes in different areas of Latin America, the range of educational options isn't as varied, and the range of profession options isn't as varied. We see it with physician assistants and nurse practitioners. I mean, in a lot of places, it's either doctor or nurse, and there's not this other set of professions with higher level autonomy and responsibilities with patients. Same goes for mental health. And so if you find yourself with your English-speaking patients talking about counselors and therapists, consider the possibility of talking about psychologists with your Spanish-speaking patients just to have less confusion and more direct communication. All right, speaking of communication, para conversar con su compañero. I've got a handful of scenarios here for you if you've got some time to do some practice with a conversation partner. So first, paciente uno. Julia tiene 15 años, Julia es 15. Sus padres están teniendo problemas en su matrimonio. Her parents are having problems in their marriage. Y ella está teniendo problemas académicos y sociales en la escuela. And she's having academic and social problems at school. Okay? So role play, one of you is Julia. The other is working with Julia through her problems, discussing, figuring out where she's at on anxiety, depression, talking through, giving some recommendations. Okay? Paciente dos. Pablo tiene 43 años. So Pablo's 43 y ha padecido depresión, and he's been depressed since his second divorce, su segundo divorcio. Sus hijos no quieren pasar tiempo con él y se siente un fracaso. His kids don't want to spend any time with him, and he feels like a failure. Paciente 3. Susana tiene 25 años. So Susana's 25 y pasó varios traumas durante su proceso de inmigrar a los Estados Unidos hace 8 años. And 8 years ago, she went through several traumas in her immigration process to the U.S. Ella no ha podido mantener un trabajo estable. She hasn't been able to keep a job. Y por su ansiedad y depresión, because of her anxiety and depression. And paciente 4. Paciente 4, Jorge tiene 79 años. Jorge is 79. Está muy deprimido. He's depressed. Ya no tiene ganas de vivir. He's got no desire to live anymore. Su esposa de 55 años se murió. So his wife of 55 years died el año pasado por COVID y se siente muy solitario y aislado. He feels lonely and isolated. Okay, so go through estas situaciones con tu compañero de práctica. One of you role plays the patient, the other is more on the provider side. And, talk through, if you want to, talk through the PHQ 9, talk through the GAD 7, and give some recomendaciones al final. If you need a conversation partner, head over to the Learning Medical Spanish Facebook group and put yourself out there. Say, hey, I'm looking for a partner who would like to chat with me. And if you've got preguntas, please post them below in the comment section. Gracias por aprender español conmigo juntos. Really, together we are improving communities. Para más español, if you're not on the Common Ground site, head over to Common Ground, poke through the medical Spanish pages and blogs, and there's tons of free lessons for you there. And if you want to take a free medical Spanish terminology test, head over to Certified Spanish here, and you can create a free account and take as many free terminology tests as you would like. All right, muchas gracias, amigos. Nos vemos la próxima semana. Chao.